So it's a 4 a.m. in the morning. Emergency room door opens. A person enters holding his side. He's sweating. He tries to sit down, then he lies down, and then immediately stands up. The pain is so intense that he cannot find a proper position. In medicine, we find different kind of pain. But the most consistently described pain as the most intense is caused by something incredibly small, a kidney stone. I am a urologist treating kidney stones, the thing I do almost daily. But the thing fascinates me is that this disease, which causes so intense pain, is often largely preventable. We have two kidneys on each side of our abdomen, connected to a storage organ, urinary bladder, through a long, thin tube. When it fills up, we find a proper place and empty it. These kidneys are incredible filters. Each day, they filter around 150 to 180 liters of blood, removing waste products and maintaining a fine balance of minerals, salt, and water of your body. Normally, these minerals are dissolved form. They are calcium oxalate, uric acid, and cysteine, etc. When this urine becomes too concentrated, these minerals crystallize. Eventually, they crystal grow and form what we call kidney stones. They are of different size, maybe small grain of sand, and they may grow to occupy whole of the kidney. Surprisingly, the size is not a problem. The problem arises when this stone decides to move. Imagine a stone 5 to 6 mm going through a thin tube that is ureter. This tube contracts and tries to push the stone downwards and goes into intense spasm. This we call renal colic. This is when the patient feels intense pain. He described this as a pain comes in waves. He cannot sit still, he cannot lie still. He paces around the room, finding desperately for a relief. And it is then the patient enters in the emergency room. This stone disease is becoming more and more common worldwide. 1 in 10 persons, they develop stones once in his lifetime. Why this is happening? This is because our lifestyle is changing. We drink less. We take more salt and processed food. We take more of animal proteins. We sit more, we move less. And researchers describe this disease as a disease of modern lifestyle. Now, the good news is the treatment of kidney stone has tremendously changed over past few decades. In the past, the removal of stone means a big surgery, long incisions, long hospital stay, significant recovery. Today, the modern urology utilizes minimally invasive treatment. We can break the stone from outside, focusing sound waves and breaking the stone into dust. We call it extracorporeal lithotripsy. Miniature cameras, flexible scopes, we introduce through the natural passage up to the stone and dust the stone with the help of laser energy. Sometimes we make keyholes up to the kidney and remove large stones from the kidney. The technology has transformed the treatment of kidney stones. But there is a surprising truth. the big insight is that the most effective treatment of kidney stone is not surgery, it is the prevention. The study finds that the 50% of the patients who develop stone once will develop another in 5 to 10 years. Unless they change something. The most effective tool in prevention of kidney stone is incredibly simple, that is water. If I can give the world a few rules to prevent kidney stone, those would be, first one is take adequate water. Adequate means 3 to 3.5 liter for an adult. The urine should be clear or faintly yellow. The second is take less salt. More salt, more calcium in the urine, more stones. Third is balanced calcium diet. Stopping calcium in diet increases the incidence of stone formation. Balance is the key. The fourth thing is less animal protein. Excessive protein causes more uric acid in stone and more stone formation. Alone, they may be small things, but together they reduce the stone disease significantly. Nowadays, the medicine is become more and more personalized. We learn to investigate the chemistry of individual urine in detail to find out what exactly is this forming this stone, to personalize the treatment, to tailor the treatment for that individual. So the technology is transforming how we treat these stones. But the truth is, can we prevent them altogether? So the kidney stone reminds us something profound. A small thing in life can cause a tremendous pain, but it reminds us something hopeful, that the small change, drinking enough water, taking balanced diet, understanding our body, can reduce this pain tremendously. So whenever you reach to a glass of water, just remember your kidneys. Because the best surgery for the stone is, for the kidney stone is the one which never become necessary. A small stone causing big pain. So to prevent it, keep yourself hydrated. Thank you very much.